Hi guys, I'm back. Hope everyone had a nice Thanksgiving holiday. So have you ever noticed that sometimes your patients just want to talk and they want to know that you care and that you're going to take good care of them? And some patients, they like to be left alone, and that's fine because they're sick and they just want to sleep, and sometimes they'll kick you out of the room or maybe throw something at you. And some patients want a lot of attention. They'll call the nurse in the room every 10 minutes thinking that they're the only patient that you're taking care of. Sometimes the night nurse will tell me, oh, I had a really rough night with this patient. They were anxious and demanding and needed a lot of things. And I'm like, okay, well, I'm going to go in and set this patient straight. Just kidding. I just kind of do whatever they tell me to do. Within reason and job description, of course. And I'm not saying to let your patients run all over you, especially if they're rude, but sometimes it helps to just do whatever you can to make them as content as possible. Sometimes I have patients that are really fidgety and restless, and they're playing with their telly box and pulling off their leads, taking off their gown, throwing sheets on the floor. One patient I had recently was taking the pillowcases off his pillows and throwing them on the floor and then yelling out, "Walmart, help me!" I noticed earlier in the day that when his family was in there, he was actually really calm. So I decided to go take my charting in there and sit down and talk to him. And of course I was being a little silly at first, and I asked him if he wanted to go to Walmart, and he said, "Yeah, go get the car." And I said, "Okay." And he's like, "Hurry up, come on." I think he was just using me to get out of the hospital. Another patient I had was also pulling off her telemonitor, and the safety attendant sitting in the room was calling me in there every 10 minutes because they aren't allowed to touch the patients. So since I had some free time, I decided to go in and sit with her. I put her telly box under the covers so she couldn't see it. Out of sight, out of mind, right? And we found a program that she liked to watch, and I was asking her questions about herself. Some people don't like to be all alone in a hospital room all day. It's like being sick when I was young and I just wanted my mom to sit there, and just her being there was comforting, even if we weren't actually talking. Sometimes it works to just go in and sit with them and talk and keep them company. Well guys, thanks for watching. I'll talk to you later, okay? Bye.